Hi, my name is Victoria Garcia, and I'm going to be providing tracheostomy care for a disposable and a non-disposable inner cannula. So the first thing that I'm going to do is I'm going to assess for pain. If the patient was feeling any pain, then I would administer the prescribed analgesics. So now what I'm going to do is I'm going to open up all of my equipment, all my sterile equipment. So I'm going to open up my new inner cannula, my sterile cotton tips, and my sterile cup for sterile saline. So I'm going to do that using sterile technique. Being careful not to contaminate the inside. I know you can't see, but yeah. And I'm going to pour my sterile saline about ½ inch into the container. So now what I'm going to do is I'm going to put a waterproof pad over the patient's chest and put on my mask. Okay. So now that I've done that, I'm going to go ahead and I'm going to remove the old inner cannula. So I'm going to don some clean gloves. This isn't sterile yet. So I'm going to gently, with my non-dominant hand, I'm going to hold the outer cannula. With my dominant hand, I'm going to remove the inner cannula. And I'm going to do this by clicking the lock mechanism, unlocking it, and gently but quickly. Oh, I forgot to remove the oxygen. I gotta remove the oxygen first. Sorry, that was my mom. And now I'm going to take out the inner cannula gently. So I'm going to twist it and then remove it, grabbing it, and then grabbing the gauze, the tracheostomy gauze, grabbing it in my hand, and then I'm going to put my glove over it like so and remove it inside my trash bag, which is right here. Okay. So now that I've done that, I am going to quickly don my sterile glove. Making sure to keep the 1-inch glue into place. I know you can't see it, but I do actually have sterile gloves here at my house, so that's what I'm using. Okay. So now that I've done that, I'm going to grab my new inner cannula with my dominant hand and dispose of this. And now I'm going to gently insert it into the outer cannula, and I'm going to hold the outer cannula with my non-dominant hand and insert the new cannula, inner cannula, with my dominant hand. So I'm going to gently but quickly insert it in and put the locking mechanisms into place. So I'm going to pretend like I did that. And now that I've done that, what I'm going to go ahead and do is I'm going to clean the stoma around it. So with my dominant hand, my sterile hand, I'm going to pick up a cotton applicator, dip it into the sterile saline. With my non-dominant hand, grab the outer cannula, and with my dominant hand, clean the stoma. Making sure after each go, you discard of it. Grab a new one, dip it into the sterile saline, and now clean the bottom of the stoma. And then discard. And now that I've done that, I'm going to go ahead and clean around the stoma with a gauze. And then discard. And now I'm going to put the tracheostomy gauze over the patient's stoma. And attach the patient's oxygen. Okay, now that I've done that, what I'm going to go ahead and do is I'm going to now replace the tracheostomy collar. If there was, if I needed assistance, then I would call for assistance and they would hold the outer cannula, but I'm going to do it on my own. So what I would do is I would open up my tracheostomy collar, and it is a Velcro. So I would take it, I would un-Velcro the old one and then Velcro the new one onto the tabs. And then I would gently remove the old collar, un-Velcro it on this side, and I would discard of it. And then I would gently push the new tracheostomy collar around the patient's neck, and I would attach it to the other tab on the other side of the outer cannula. And then I would check for sizing. So how I would do that is I would make sure at least 2 fingers can fit around or inside of the collar, making sure it's not too tight for the patient and that the patient is comfortable. If I were to be doing it with a non-disposable inner cannula, how I would do that is it would be a little different. I would have poured my sterile saline into my basin, and once I had taken out the inner cannula, I would have dropped it in my normal saline. And I would have let it sit there for a little bit while I cleaned up the patient. And then, still using sterile technique, I would have picked up the inner cannula, and I would have cleaned it with a sterile toothette. So I would clean it, making sure that it's really clean, no secretions. And then what I would do is I would tap it still on the inside of my sterile field. I would tap it to make sure that it remains sterile. And then what I would do with my non-dominant hand, my non-sterile hand, I would hold the outer cannula. With my dominant hand, I would have gently inserted the non-disposable inner cannula. And then the same procedures would have applied with the gauze and cleaning the stoma. And now what I would do is I would make sure the patient is in a comfortable position. Then I would document how the patient responded to the procedure, and I would document. Thank you so much. That's it.